Powered only by the wind and the sun, it's the Medicare for the Lazy Man podcast. The Medicare podcast that sleeps late every morning. And now, proving he wasn't born in a barn, it's Medicare expert Doug Jones.
Hello, everybody. Welcome to another thrill-packed episode of the Medicare for the Lazy Man podcast. This is Doug Jones, in case my Canadian nephew Drew McMillan has not already told you. And I'm here to help you feel confident and even anticipatory about your coming transition to Medicare. And I'm assuming that you have a transition to Medicare coming in your future. Most of us do. It can come for you when you turn 65, or it can come for you when you leave your job and leave your company health insurance. Either way, you're going to find that Medicare is not a bad way to go. Sure, it's a ponderous, huge, it's a drain on the economic well-being of the United States, but you personally will find it to be excellent coverage at a very reasonable cost. And it's my job to help you discover that new unspoken world of Medicare that is reasonable and yet not expensive. One way that I help people understand that is to offer my book, Medicare for the Lazy Man. The current edition that's out now is 2024. So if you go to barnesandnoble.com or amazon.com and type into the search window, Medicare for the Lazy Man 2024, you're going to learn all about what it's like to have Medicare knowledge in the palm of your hand. All you have to do is purchase, especially at Amazon.com, one of the 4 types of books that are on sale there. You can have the Audible book that you can listen to. You can have the Kindle version that will be downloaded instantly to your reader. You can have the paperback book that most people seem to opt out for, and you can have the hardcover book, which is it can be used as a shield if you ever in a war reenacting situation, and or let's say you're playing paintball and you need some sort of a protection against your friends that are shooting paintball balls at you. It can be used for many, many things, which makes its $24 price seem quite reasonable. But the ultimate fact is that you will have knowledge about Medicare like you never thought you would have, and your friends and your loved ones will look at you with new respect, because after having read Medicare for the Lazy Man, you're going to know more about Medicare than anybody that you know. You'll become an expert overnight just for having read the book. So that's my suggestion to you. When you finish reading my book, you will also know my email address, because it's located prominently in a couple of different places in the book. I would encourage you to let me know when you're just a few months away from your Medicare transition, because I can help you with the transition to Medicare and the acquisition of the additional insurance policies that you're going to want in order to round out your protection, your health insurance protection. And then you're going to be set. You're going to say, hey, I don't need to even think about this stuff anymore. I am finished. And you'll look like a genius, once again, to all your friends and loved ones. So join us in the Medicare for the Lazy Man world. And when I say us, I'm talking about me, and I'm talking about Randy Carson, the guy who's really in charge of this podcast that we do every so often. Randy, it's good to see you again. Looks like you're sitting in your swimming pool. Must be one of them fancy backgrounds that you got.
Yes, it is. But, ultimately I'm not in the pool, but I'm right beside it. But there's one thing I have to whine about.
Oh,
and
boy.
you probably know where this is going.
Does it have anything to do with quarters?
No.
Oh, well, you got a new subject to whine about. Cool. It's Arizona freezing. Is that what I'm getting?
It is. It's only 59 degrees. I had to go rub my hands over the fire to get warmed up to come in here, because 59 degrees is ultimately Arizona freezing in my world.
Well, it's very weird that you would have a colder temperature than I have because you're down the mountain. I'm up in the stratosphere. I am reading 61 degrees right now. So
Oh,
that's,
so we're always about 2 degrees difference, but
yeah,
you're on the winning side today.
this is ass backwards, but I'll take it. I'll go outside and enjoy the relative warmth. But it is the middle of winter. We just had the shortest day of the year, and we are going to be suffering this Arizona freezing until probably February, don't you think?
I know it's terrible. I don't know how I do it, Doug.
Well, you're to be commended for your courage and your fortitude.
Well, you know something? As you know, one of the things that I have to take care of on every episode because it's part of my duties as the producer.
Yeah. Oh, you said duty again.
I know. It's one of my favorite words. So you might want to explain to the audience what I'm about to identify
Yes.
because I don't want to confuse anybody.
Ladies and gentlemen, every episode we are dedicated to the proposition that we can protect, if we can just save one person from enrolling in a Medicare Advantage plan, we will have deemed this whole effort worthwhile. One of the ways that we do that is I've collected a pile of Medicare Advantage articles and put them in a stack. I've numbered them sequentially, and then I ask Randy which article we should read or which one we should approach for our existing podcast episode, because we don't want to read every article. Every podcast episode would be boring and dull and not interesting, and just be stupid. So we're going to limit ourselves to just a short segment each episode, and Randy's in charge of the content for that particular Medicare Advantage Minute. So Randy, what's your choice for today?
I have a number chosen, but if I had a drum roll, I would do
Yeah.
it. But I need to congratulate you,
You're the
Mr. Jones.
technical guy. You ought to be able to find a drum roll out there that you can use.
Well, I may before we publish this, but bottom line is, do you know what this episode is? What is the monumental accomplishment that this episode represents?
Oh my God, it is episode number 750. I had forgotten about that.
750. Yes, you
Yeah.
are absolutely correct. So I congratulate you, sir, on a job well done.
Well,
And
thank
bottom
you.
line is I'm glad to have been part of it.
Well, I'm glad to have you be part of it. The only time we ever missed, and it was probably 3 or 4 weeks, was when you had COVID and they slapped you into that hospital, and then they wouldn't even tell you where you were. They kept
Yeah,
coming in and torturing you. Where are you? And I don't know.
yeah.
So they
I
kept you
kid.
there.
It's a true story. Doug speaks the truth. Every morning they would come in when I was in the. It wasn't intensive. It was some sort of a
It was
special
a, yeah, it was like a
infectious disease
contagious,
ward.
contagious.
Yeah,
Yes.
they would come into my room, all duded up like spacemen,
Yeah.
and they'd say, "All right, here's your question for today. Where are you?" And the first day they did this, I said, "Well, I'm in a hospital," and they go,
Not
"No,
good enough. Not
not
good enough.
good, not even close. No cigar, nothing."
Yeah. That was in January of 2021, as I recall, because we went for a
Yeah,
year during while COVID was raging, and you and I were healthy as horses. And then all of a sudden, Margaret got it, and they
yeah.
hauled her off to the hospital, and then you got it, and you had it 3 times as bad as she did.
And guess who I got mine from, as you
I
might
don't know.
imagine?
Oh, yeah. Well, I do know, I guess.
Margaret.
Yes, yes.
Yeah,
Um,
I had kind of not a rougher go of it, but bottom line is I was in the hospital for a lot longer than she was, and then as as the good friend that you are, you were delivering oxygen tanks to me at home for a while.
well, the oxygen tank supply company said, "I'm sorry, we're too busy. You're just going to have to die." And so,
Yeah. So
so
can you? They'd say, "Well, come get it," and I go, "I have no oxygen. How can I get there?"
yeah, yeah. So you had the plug-in oxygen creator, but you
Yeah.
couldn't take that in the car because you didn't have a cord that was 20 miles long to drive
Well,
across town to,
that plus the generator weighed about 60 pounds, for God's
yeah.
sakes,
Well,
and
so we,
it had a hose on it. And as you might imagine, No, you and I both would be millionaires over 10 times if we could figure out how to make one of these hoses that doesn't kink up into knots.
Yeah, yeah, really. Well, I think the guy that used to be on Tim Allen's sitcom sells a hose like that, but it has kind of a short lifespan out here in the Arizona sun. Well, anyway, I did want to say that a year after that, I went to a brand new Abrazo hospital in the neighborhood here, 8 beds and a friendly staff, and they did the same thing to me. They would not let me drive home until I answered a bunch of questions like what's your social security number and stuff like that. So I think there was a whole protocol around assessing mental acuity during COVID times. But anyway, so have you picked out a number for us, or are we
I
just going to
have.
jaw jack all morning?
I have. So I'm going to give just a little bit of a lead up into this. In the last episode, I picked a number of 16.
Yes, you did.
Okay. Now in this one, I'm going to pick a number of 32.
Okay.
And there's a very significant relationship between those two numbers, not just that one is double of the other.
You mean there's more?
Yes, there's much more in terms of the relationship, but I'm not going to say what it is. And the next episode that we record, I'm going to ask that of you as a let's stump the insurance guy question.
I predict that I'll be stumped. That's my prediction. Because frankly, number 16, let me look back and see what our subject matter was on article number 16. It was a very rewarding one. Hospitals sick of fighting for Medicare Advantage dollars. We learned how many hospitals are so upset that they can't collect from the insurance companies they're bound. I mean, they're legally bound to pay the bills of the people of their members. And this article is HCA, that's the government. So the government sees way too many denials, especially for Medicare Advantage. So there's a connection between 16 and 32 that I haven't spotted yet. Is that what you're telling me?
Yes, it has nothing to do with the content.
Okay. It has something to do with,
Has something to do with the numbers.
well, you said that it's not that one is double the other.
It's not.
So is it available or is it apparent on my list? My
No.
Medicare Advantage Minute. Okay, so this
No.
is made up inside your head. Is that what I'm getting?
No, anybody, okay, I'll give you a little bit of a hint and I'll give the audience a little bit of a hint. It has to do with me being an IT guy.
Oh boy. Okay, so it has something to do with a factor uh, of a multiple of something or other. Is that what it is?
They're both powers of two.
Okay. Well, isn't almost every even number a power of two at some point?
No.
No. Okay. So we've just delved a little more deeply than I ever expected to into the brain of one Randall Carson. And you might want to put your head down on your pillow and rest while I deal with this article, because I think you're getting a little too cerebral for the rest of us.
Oh, okay. Well, I'm gonna mute myself out, and just so you know, I'm gonna be smiling like a Cheshire cat for the rest of the episode.
Yeah, because you did stump the insurance guy. That's for sure. No doubt about it. All right, here we go. So HCA is a healthcare organization based in Nashville. And the headline here is HCA sees way too many denials, especially for Medicare Advantage. They have reported a modest reduction in prior authorization denials for accounts with 2 midnights or more in a hospital. But it still has way too many denials, with large Medicare Advantage plans driving a significant portion of those denials, according to their CEO. This particular healthcare organization has 187 hospitals. It's a for-profit system, and it's doubled down on denial mitigation strategies through its revenue cycle in recent years. But it noted that commercial payers, these are Medicare Advantage insurance plans, have ramped up the intensity of their denial activities. However, given our focus and investment in these areas, we've been able to moderate the rate of growth in denial write-offs this year compared to the prior year. So what this outfit is saying is we've got 182 hospitals. We put our best brains to work on trying to beat these guys at their own game. And so I'm reading the highlighted areas that the content curator has made apparent to me. One is a quote: "We are now starting to get some of our first quarter denials through the entire adjudication process, and we're pursuing these cases through dispute resolution. Dispute resolution can take 1 to 2 years to fully complete, so we will need to continue this strategy going forward." Medicare Advantage now represents 58% of this particular healthcare company's total Medicare volume, and the ratio of observation to inpatient stays. Now that's how long the patient stays in the hospital. If you go to a hospital, even if you stay 2 nights, you can still be considered not to be an inpatient, but to be a patient who is there for observation only. And the rate of compensation to the hospital is different for those two. When you're there for observation, they can't collect as much from your insurance company as if you're there as an inpatient, which would be more than 2 nights, 2 midnights in the hospital. So the insurance company doesn't want any more than 2 midnight stays, and the hospital wants you to be considered an inpatient for the purposes of their reimbursement. So let's see, still significantly higher for Medicare Advantage than traditional Medicare. The ratio of observation, which is cheap, to inpatient stays is still significantly higher for Medicare Advantage than for traditional Medicare, even 9 months past the 2 midnight rule implementation. The government's expansion of the 2 midnight rule requires patients to be admitted as an inpatient if the treating clinician determines that they require hospital care that extends beyond 2 midnights, rather than being held under observation status as an outpatient. However, a recent analysis of hospital claims by Kodiak Solutions found that payors, that's in Medicare Advantage insurance companies, they're continuing to apply their own criteria for inpatient admission, and they're dismissing the 2 midnight rule for their Medicare participants. This HCA outfit with 187 hospitals has reported that Medicare Advantage case mix index adjusted length of stay ratio is about 10% higher than for traditional Medicare, which executives say is driven by the payer-influenced discharge delays. Since the expansion of the 2 midnight rule, this HCA's same facility total Medicare admissions increased by 5.3% year over year in the third quarter, primarily due to the expansion of the 2 midnight rule. Traditional Medicare admissions were essentially flat, while Medicare Advantage admissions grew by 11%. So that's a lot of statistics, but the bottom line is that hospital is working hard to try to squeeze their promised profit out of the insurance companies, the Medicare Advantage companies. It's like warfare. Okay, they're good at their tricks. We'll try to beat them at their own game, and it's going to be a back and forth. It's not supposed to be like that, ladies and gentlemen. Insurance is supposed to cover the risk of someone needing expensive medical treatment. It's not supposed to be a game of one-upsmanship between some, I think, crooked insurance company executives and accountants versus some hapless hospitals and doctors trying desperately to make a decent living. With that said, I'm going to say that it's time for us to enjoy some commercials. We'll lay back and relax, and perhaps they'll entertain us for a while. That's my plan anyway. Ooh, I hope that was fun to listen to. I won't know until many days in the future, but maybe we've done a good thing for our listeners. We've provided them with a little entertainment that normally they don't get on other podcast episodes. Now, another thing that we have done recently is we've discovered a book that the feds have put out called Your Medicare Benefits. It's got a picture of a very odd-looking lady on the front, and it has a list of all of the things that Medicare either covers, or we'd like to know how they cover them, if they cover them at all. They might say they don't cover anything. It's 113 pages. It's a list of all kinds of procedures. Last time we did aortic aneurysms, and this time, because we're doing the same type of thing, it's all alphabetical. This is going to be advanced care planning. So let's see how Medicare would treat advanced care planning. Part B is in boy of Medicare. That's your outpatient health insurance under Medicare. That covers voluntary advanced care planning as part of your yearly preventive wellness visit. Go to the preventive visits listing on pages 90 to 92 for more information. Medicare may also cover this service as part of your medical treatment. Advanced care planning involves discussing and preparing for care that you would get in the future if you need help making decisions for yourself. As part of advanced care planning, you may choose to complete an advance directive. This is an important legal document that records your wishes about medical treatment in the future if you cannot make decisions about your care. Advance directives carry two parts. Number one, your health care proxy, sometimes called a durable power of attorney, and that names someone that you trust to make decisions about your health if you cannot. And the second element of advance directives is your living will, which describes which treatment you want if your life is threatened, including dialysis, breathing, the use of breathing machines, resuscitation, and tube feeding. It also states if you want your organs or tissue donated after you die. You can talk about an advance directive with an attorney or your health care provider, and they can help you fill out the forms. You can update your advance directives at any time. The costs. You pay nothing for this planning if your doctor or other healthcare provider accepts Medicare assignment, and if it's part of your yearly wellness visit. If you get it as part of your medical treatment, the Part B deductible and coinsurance will apply. Things to know. Consider carefully who you want to speak for you and what direction you want to give. You have the right to carry out your plans as you choose without discrimination based on your age or disability. For help with the advance directives, visit the Elder Care Locator at eldercare.act.gov. You can also contact your state health department. I don't think we want to be involving too many government entities here. And so their final notation is, if you want to read this online, you can go to medicare.gov/coverage/advance-care-planning. So that's another of the many, many Medicare services or items that are addressed in your Medicare benefits. The other thing that is often an entertaining part of our Medicare or our Medicare for the Lazy Man podcast is correspondence with people who either are clients or want to become clients. This is a big favorite of the content curator, and it's often entertaining, but once in a while it touches the heartstrings. And that's what happened just the other day when I received some correspondence from a woman in New York. And her email to me is entitled "Help," and it's all in capital letters with 4 exclamation points, and then "us, comma, please" with 3 exclamation points. So it's basically "help us, please." It's a plaintive cry for help. So the woman starts out, "My husband fell for a nice lady insurance agent selling a cheap Medicare Advantage plan. I had been avoiding them. They weren't pushy, and now I know why." Or they were very pushy, excuse me. She said, "I had been avoiding them because they were very pushy, and now I know why after reading your book." And what my book says is the reason these people love to sell Medicare Advantage plans is they make a big fat commission on every one. And I believe that commission is up over $600 a year for each Medicare Advantage person that they enroll. So her husband quit his job to manage the wife's care after she had a massive stroke. I was on a basic Medicare plan then. I was airlifted to a stroke center where my life was saved, and I received great physical, speech, and occupational therapy. I was also scanned numerous times to try to figure out why I had the stroke. They discovered that I had endometrial cancer with very large tumors. I received treatment, chemotherapy, immunotherapy, and finally surgery. They did a huge debulking, taking out the biggest uterus the doctor had ever removed, some lymph nodes and fatty tissue. I received great news that I was now labeled cancer-free. I did need to pay for an IV port in my arm and supplies to keep the line clear. A portion of that was covered by a church charity. After all of this, which sounds like a nightmare, my husband talked with great enthusiastic Blue Cross Blue Shield. Talked with a great enthusiastic Blue Cross Blue Shield agent who signed both of us up for this fantastic Advantage plan. And here is the consequence. She said, I now have to wait for permission to receive scans to check me for cancer reoccurrences, and I have to pay up to $1,600 for each CT scan that I get. This past summer, I fell and broke my pelvis in 3 places, and now I have to pay $1,700 for a week's stay in a hospital, and who knows how much for 3 weeks in the rehab facility I stayed in. Plus, I've needed outpatient rehab, and I'm now paying a significant amount for that as well. She said my HSA account, that's the money that she saved when she was had an HSA account and her husband was working, the money is almost completely gone. And she says, please, can you help us get extracted from this horrific Medicare Advantage plan and help us get into a plan that is actually helpful for us? And she gives me her prescriptions, her husband's prescriptions. I mean, she's very thorough. Address, all the information that I would need in order to figure out what could be done to save them from this evil Medicare Advantage plan. And it turns out that the cost for them to improve their coverage to the maximum extent that I can figure out is going to be $60 a month for each of them. I think that they're very pleased about that. So here is my response. How can I not do my best to improve your health insurance situation? No guarantees yet, because they missed the open enrollment period where they could just disenroll automatically from their existing Medicare Advantage plan that they don't want and then re-enroll in a guaranteed issue Medicare supplement plan in their state. They live in a state that allows that. So this would have been a done deal if they had instituted this action before December 7th. But since they missed it, we now have to follow the oddball rules of the Medicare Advantage open enrollment period, which starts on January 1st and goes for 3 months. So I said, if I'm correct, the nasty Medicare Advantage plan will end on January 31st, and your new coverages will begin on February 1st if my plan for your salvation is going to work properly. In the meantime, I have some homework for you. I said the first attachment is a short questionnaire. Fill this one out for each of you. And then let's see here, the 3-page questionnaire. Second attachment, your drug plans. Additionally, please send me copies of your existing Medicare cards and your Medicare Advantage cards. I anticipate that each of your costs will be as follows. $185 per month for Medicare Part B. Now, everybody's paying that or more if you have the IRMA penalty. So this won't be any change in their current expenditure. And then I said, and $60 a month for your Medicare supplement. That is quite the bargain, ladies and gentlemen. And an unknown amount for your prescription drug plans. It could be zero, could be more than that, but I won't know until I crunch the numbers. That all depends on which plan works out the best for each of your drug requirements. Let me know about any questions or concerns you have. Otherwise, let's go to work on this project and get it done for you. And then I called an insurance company in New York and asked for their advice because I've never dealt with a change during the Medicare Advantage in open enrollment period. And so I had to call this company in New York, and I got some detail, and then I got a message from her saying, Dear Mr. Jones, thank you with all my heart for helping us get out of this horrible Advantage plan. You are a hero. When we originally signed up for Medicare, we had Social Security deduct our medical insurance from our Social Security checks and pay Medicare. Can we go back to that arrangement again, please? Monthly automatic deduction. Do I need to give you our checking and savings account numbers, and on and on and on? She's just very grateful. And so what I had to do after talking to the insurance company was I had to go back to them and say, here's what you do to make this go forward. We have to get a written notice of termination from your Medicare Advantage plan. And the way we do that is to call Medicare, and I gave them telephone numbers. Call them and tell them you want out of the Medicare Advantage plan. Call the Medicare Advantage plan, tell them you want to resign from the Medicare Advantage plan. Between those 2 phone calls, you should be generating a written document from Medicare announcing that you have been terminated from your Medicare Advantage plan. When that document arrives for each of you, that's the green light to go ahead and get your enrollment in the Medicare supplement plan. Your enrollment in Medicare Parts A and B will have returned because, as you know, a Medicare Advantage plan takes that away from you, and all will be right with the world. So unfortunately, I had to tell these people, look, you created the mess. You got to help me uncreate it. And when it's done, everything will be improved. So that's what I do for some people. Whenever I have the opportunity, it's very rewarding. And I got to tell you, this woman sounds like she's going to be very pleased to be back in the land of Medicare supplements and out of the land of Medicare Advantage plans. Randy, it almost brings a tear to my eye when I can do so much good for people that have made that mistake.
That's a great story. I love hearing those kind of stories. And folks, there's a lot of stories just like that Doug could tell. But the other thing I was going to ask you is people probably don't realize the reason that I have coined the phrase Medicare Advantage zombies.
I'd like to hear your explanation again.
Because they don't care, man. Zombies have no interest in anything other than eating your brain. And, if you look at a zombie from a movie perspective,
Yeah.
but ultimately they don't care about you. And the other thing I was going to say is stay away from Medicare Advantage plans. I don't care what you think of them. I don't care what anybody tells you. Just stay away. And do you know how you tell whether a Medicare Advantage zombie is lying?
I know.
How?
His lips are moving.
His lips are moving. That's exactly right. So don't forget, we are telling you this straight scoop. Don't believe what anybody else tells you. The further you can stay away from Medicare Advantage zombies, the happier you will be, as proven by this great heartfelt story that Doug just told us. So ultimately, we need to sign off for today, but that's a great story. But grab your pencil. You may want to just write this down because you may feel the need to reach out to Doug right after this particular podcast episode. And you can do that at dbj@mlmmailbag.com. Let me repeat that. That's an important email address, dbj@mlmmailbag.com. Doug is licensed nationwide to help you with your Medicare supplement planning, just like he did for this family. Medicare for the lazyman.com, our brand new shiny website. Take a look. We think it's pretty cool. Number 3, if you could find a place to drop a few reviews for us and you're wandering through the internet before year end or even after year end, doesn't matter. You can help us out any time of the year to make us lead above and beyond the travel logs. We always beat the travel logs, and that's kind of our measurement, is whether we beat the travel logs. And last but certainly not least, thank you for joining us. You could have been anywhere doing anything else, and you weren't. You were with us, which is exactly where we love to have you. But I know darn well, because you never do, you did not check your wristwatch to find out that you have just spent about 32 and a half minutes with Doug Jones, the insurance guy, originally from Oklahoma. No more. He's living up in the high ground behind Cave Creek, Arizona, in his fortress of solitude. And because this being a very, very notable episode of 750, I'm going to take it easy on Doug today. I'm going to put him in at 5,750 feet.
I can live with that very nicely. In fact, I may go swimming outside this afternoon. It's going to be so nice and warm. Thank you so much, Randy, and thank you, ladies and gentlemen, for joining us today. Won't you come back for our next episode? I sure hope so. Bye-bye.